everybody, ministers, speakers, colleagues and guests. Thank you all very much for being here today and welcome to this really important and timely conference, which is organised by Martina and the team and with our external partners to try to provide an opportunity for us to discuss and to debate on how we take the tobacco control agenda forward. This agenda being committed to saving lives and protecting health, but how do we take it to the next level, given that we know that the work that we've done to date hasn't protected or promoted health for all equally. We're really excited about the 4 reports that are being launched today, both the implementation plan, the 4-year implementation plan, a really solid piece of work, stepping out the actions that we can take as an organisation, working with our partners to try to influence and impact those figures, which Paul will be talking about later and which are so stark. Our State of Tobacco Control report, the Adult Smoking report and the Youth Smoking report. The increased momentum behind the tobacco control agenda in Ireland has certainly been supported significantly by the wider approach the government, the HSE and cross-sectoral partners are taking to the implementation of the Healthy Ireland framework that Martina mentioned, which is now, would you believe, 5 years old. And that's about increasing the health and well-being in the population, reducing health inequalities, protecting the public from threats to health and well-being, and enabling every sector of society to play its part. And there's a huge amount of work that's been happening over the last 5 years to try and bring that to life in many sectors, but particularly within the HSE, for us to try to be obsessed about health as we are about hospitals, in the words of Duncan Selby. The leadership that we've had from government over that period of time has been significant, and it certainly has helped us and given us an authority and a mandate to have discussions that have oftentimes been challenging with partners or with people who wouldn't necessarily see this agenda as being the primary agenda or the most important agenda. The mandate certainly within the HSE is further reinforced because health sector policy now and indeed into the future via Sláintecare continues to ensure that health and wellbeing reform is a core pillar. And we are trying to deliver a very robust implementation plan for Healthy Ireland within the health service, and the tobacco control programme is one of those flagship programmes within that. We now have leadership, expertise and capacity within the health service to actually translate government policy as it relates to these areas, as it relates to tobacco control, as it relates to healthy eating, active living, as it relates to sexual health, child health and alcohol misuse. So we have policy priority programmes, of which the tobacco control programme is one, translating that government strategy, government policy into tangible actions that can be taken at the level of a nurse within a hospital or a dietitian within a community healthcare organisation. We've also developed a national hub to try and coordinate this work across hospital groups and CHOs and indeed with external partners, both at the national level, the regional level and the local level. We've created key management roles, leaders within hospital groups, heads of service for health and wellbeing within community healthcare organisations to try to provide a formal infrastructure that can lead this work out into the future. To date, we've had 5 hospital group plans for Healthy Ireland launched. All of the community healthcare organisations are developing plans, 3 of which are launched. And I know that the Minister has been very, again, supportive in kind of leading and supporting us to launch that work and encouraging us to continue with it. We're building capacity with our local staff. So, for example, all of our staff who sit on local community development committees at local authority level, we bring them together frequently, supporting them with information so that they can advocate, so that they can influence, so that they can bring the evidence base to, for example, local community development and economic plans at the local level, working with local authorities. And indeed, we've increased significantly the number of national partners that we're working with on this agenda. I've mentioned earlier that certainly the Tobacco Free Ireland programme is one of our flagship programmes within all of this. And it's been going from strength to strength, but I think that we all recognise that the challenges right now could not be more stark. But the thing that impresses me most about the tobacco control programme is the drive and the ambition in Martina leading the programme and in the wider team and with our partners, with Ed, Kate, Paul Kavanagh, who's been supporting the programme for the last number of years, with our communications colleagues, Rachel and Marissa, with our public health and our environmental health colleagues, and with a range of external partners who are working doggedly on this agenda, but who recognise now that we've done so much, we've achieved so much, but we've got probably the hardest nut to crack in terms of the health inequalities issue that is really underpinning all of our intelligence to date. So much has been achieved, but there's a real clear recognition, and you'll see it within the agenda today, within the setup of the workshops, to provide that discussion and debate, to be able to support us in redoubling our efforts and maybe in developing some of our thoughts, some of our thinking, so that we can get some concrete ideas around what it is that we need to do, working with the community and working directly with individuals to address this issue. I think that the professionalism brought to this work is well evidenced by the outputs from the research and our award-winning communications campaigns to our service developments that we've managed to develop even in the context of very difficult kind of budgetary environments over the last number of years. And I think the reports before you today are a testament to that. I'd really like to acknowledge the role, and I know I've done this before, but it's very important. It's lovely coming to these events because you see people who know each other very well over the years and indeed decades, if I can say, for the people who really tirelessly advocated for this agenda when there was no public health focus on this whatsoever. And I'd really like to recognise and to thank those people, because certainly we feel that we're standing on your shoulders, and I hope that you think, even though you continue to work in this field, I hope that you think that the work that we're doing continues to strengthen, and that indeed we are preparing the ground and the environment for future generations to come. As Martina said, there's a great mix of participants here today, and the focus is for us to understand the research, the intelligence that's coming through, the insights that are coming through from that research, with a view to us identifying and acknowledging the wide set of actions now that need to be taken to really address where we have significant disparities in the data across social groups in Ireland. Thank you all very much for coming, and I'd now like to introduce the Minister and to acknowledge again, Minister, that you get invited to loads of different events, but for us leading this work, it's so important having the support of the Department of Health, having somebody like you in that position who is prepared to listen and understand the agenda and prepared to kind of support the work that we do. And as I say, it's not always an easy space to be in. So knowing that we have that support gives us the confidence to be able to go out and say, this is important, this does need to be addressed, and we need you to work with us to try and resolve it. So thank you.